My name is Emma Schaber, and I did an informational interview with a close family friend because I knew that she had a background in healthcare, but I wasn't exactly sure what that was. Her name is Carolyn Anderson, and she works for Mountain View Medical Center as a clinical quality director for both locations in Hillsboro and Forest Grove, Oregon. She worked in this position for about 4 years now, but has been also working in healthcare for a little over 35 years. In my interview, I asked her several questions to help me gauge whether or not I'd be interested in a position like this in my future at some point, but here are some of the questions that I asked during my informational interview. The first one is, what is your official job title? And she responded, I am a clinical quality director for Mountain View Medical Center. In both Hillsboro and Forest Grove, I am responsible for both locations, but I am mostly based out of Hillsboro. The practice is run out of family medicine, and it is independently owned by Dr. Gray. There are 14 doctors in Dr. Gray's family, and 3 of them bounce back and forth between the 2 different locations. My second question is, what exactly is it that you do that falls under your job description? All things quality, she replied. That's how her boss describes it. On a day-to-day basis, she manages health plan quality incentive programs, and this includes state Medicaid, federal Medicaid programs, commercial plans such as under the age of 65 or children or even just your average Joe. I also help manage a system that monitors chronic conditions. I help work on preventative care, and I help the staff identify gaps in someone else's care or the care of a specific population in order to target what else it is that they've been lacking. I work on data analytics a lot as well, so we pull different populations, and depending on the kinds of results that we receive, we implement a new program to support something that the community might be lacking. My third question that I asked was, what does the starting salary look like for this job? And she hesitated a little bit because she didn't know for sure, but she said somewhere between probably $50,000 and $65,000 annually, but that was just like an average number that she came up with. My fourth question that I came up with is, what kind of education did you go through to meet the requirements of the job? And she said that she received her bachelor's from George Fox University and got her project management certificate from the University of Colorado. Colorado was one of the only programs that offered this certificate at this time, and she took a lot of technical writing classes as well. That was important. She received another certification from Intel. She did a 25-week series data analytics course at OHSU, did some training at CQI, and in addition to those, she also has a seat on the Primary Care Reform Board in the state of Oregon. The last important thing to know for sure is that electronic health records are very highly used in this field. They are basically mandated, she said, so getting to know your electronics is really important. It's not a requirement, but she has also helped legislators build a state law that reinforces preventative medicine in Oregon. The fifth question that I asked was, what is the best part of this job? And she said that she loved the variety. She gets involved and she has a major impact in the community that she lives in. Her little corner of the world is how she said it. The leadership skills that her bosses have is admirable, and she and her team are all very committed to the work that they do. They have a good standard of morals, and they are a very good group of people. She said that she feels like she really gets to make a difference, and there's a good foundation of mutual respect that's been established among her coworkers. The next question that I asked was, what would I have to do in order to further my educational career towards this career path specifically? Little bit of a confusing question, but she answered that you would have to have a background in project management, and that would be very important. Population management could also be a degree path that you could take. Public health background would be super helpful, and some kind of certificate or minor in data analytics would help a lot. She said that a master's is not necessarily needed, but it definitely would help. Of course, it would look good on your resume. Communication is key where she works, so you would have to navigate that as well. Constant training in the field. She said that she does training probably a couple times a year, which is required. And so after conducting this interview, I think that I would be interested in having this job in the future. There are a lot of aspects that I think I would enjoy about this job, even though the data analytics part would probably be my least favorite. The career path that I'm on now is something I still believe that I can succeed with. And if I choose otherwise, I could see myself in this position one day. But I've had a lot of fun conducting this interview and learning more about this career path, and now I hope to learn more from my classmates and see what other jobs might be out there for me. Thank you.